The following is a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Hey, welcome once again to PinPoint Health, the PinPoint Health Show. We love having you here and reaching out to Dr. Lou. Do yourself a favor, have a chat. It's very chilled, but it could also be information that could turn things around for you. If you're willing to listen and ask the right questions, do it anytime. 1-855-55-Dr. Lou, DRLOU. info@pinpointhealth.ca, info@pinpointhealth.ca. And you can catch the Lou Down, the long-form podcast. Dr. Lou, I believe you're still doing. There's some great information on there. It's worth a watch for sure, wherever you catch your favorite podcast. But we're here for another week, pal. What's on the table for us?
Yeah, John. So, I mean, as always, health is the priority of this show, as it being the PinPoint Health Show. Pretty self-explanatory. One of the things that I'm really interested to speak about today, and I sort of want to dedicate the show to this, is actually the genomic testing that I've been now recommending to patients for a number of months. Something very interesting has recently happened with the company that we use in order to do this genomic testing. Once upon a time, it was always a very good test. The test is incredible. The report that was put together was very let's say it was very medical practitioner focused. So it was, easy enough for me to understand, but when a patient would receive their results, it was almost like potentially another language for them, and to some extent, right? There was still pretty good explanation, but it didn't get right to, people at the end of the day want to know a couple things, like, okay, what are my risks from a genetic perspective, and what are the things that I could be doing? They want it as simple as possible. Right. And, telling someone, well, this specific gene, you have 2 copies of it. Again, to the average person, that's not really the interest as to why they're doing this type of testing. So something that the company worked very hard on to, I guess this was something that they were hearing, not just from myself, but from other consumers of the product, that something that's probably a little bit more average person digestible. And when I say average person, I mean people with no medical training. And they've put together a whole new comprehensive 360-degree report that I think is absolutely phenomenal. And what they did was my genetic test that I've spoken about before. They actually sent me mine with that now in that format. I've looked at it briefly, in all honesty, but I didn't want to look at it in depth until I looked at it on the show, because I actually wanted to share it with the audience and sort of go through. I took a very quick scan over it, and just the way it's broken down was incredible. Like, it gives you where you are. And without me going too much from a high level, I want to just get into it. So one of the things that they've done is they've broken down the report now into 6 categories, 6 categories that people can find out about themselves. Before, it was 4 big categories. Right now, they've done sleep is a category in and of itself. Mood is another category. Cardiovascular health, immunity, hormones, and diet and nutrition. All sort of the things that people want to know when it comes to their health. So there's actually, because it's broken down that way, what ends up happening is you get 6 different reports on each of those sections. So right now, I'm pulling up my sleep profile. Very, very easy to understand. In fact, it starts by showing you a 1-page summary of, hey, here are the genes that you have. And again, to the average person, seeing that, on the BDNF gene, I have the result of a gene means nothing, right? That's just medical jargon that doesn't provide value. Where there's an incredible level of value is as I keep scrolling down more, it says your sleep grade, and it gives me a grade like as you would in school. And my sleep grade, based on my genetics, is a D. Now, you don't have to be a medical professional to understand that that's already not good, right? Like, if you're getting a D in something, there's something up there. And it gives a summary, and I'm going to read it. So the summary following my D says, based on your unique genomic profile, our analysis suggests that you have suboptimal genetic sleep profile. Some of your genes may be contributing to your inability to get a good night's sleep. Talk to your clinician about implementing the recommendations that come in this report. That's the other incredible thing, is that now there's a bunch of recommendations that are going to be in this. And this is broken down even further from section by section within sleep. So sleep is made up of a lot of different things. It's made up of your circadian rhythm, your stress response, and that's where it starts. So it'll tell me my circadian rhythm is a D, my stress response is a B, and so on and so forth. I'm not going to go through every single little thing here, but I think that right away, like that overall, giving someone because that's what I do essentially when I sit with somebody following their genomic testing. I would look at it from the totality and say, okay, based on what I see here, here's sort of what you have. This is a perfect summary. From a sleep profile, I don't have to be a clinician to understand that when I look at that, I'm a D, and that's probably not a good thing. And throughout this report, it will give sort of these helpful tips for people. So me being a D, it says consider doing these one-time actions in order to improve my sleep. So program all your digital devices to go into sleep mode after 7 p.m. So just don't use digital devices after 7 p.m. Inform your work colleagues about your offline hours between 8 p.m. and 8 a.m. Set your thermostat for sleep between 18 to 21 degrees Celsius. Purchase blackout curtains and white noise machine, and schedule your router to go offline at 8 p.m. These are incredibly helpful tips for the average person who's sitting there saying, okay, my sleep is poor. This is what this report is telling me. But what is it that I can do about that? And there's, boom, right there, some quick tips, other quick tips that, then there's another section that says, create these habits. Put your phone on your charger at 7 p.m. and leave it there. Read a book in bed each night. Drink a cup of chamomile tea before bed. Stand in front of an open door window each morning as your coffee brews. So it's just giving you these habits and behaviors. And again, I'm not going to go through every single one that I have here, but I guess the point I'm trying to make is the simplicity of this for the average person to understand provides, in my opinion, extreme value.
Well, it's interesting too, because it's not just based on someone having a look down your throat or saying this is what I did to help my sleep. This is based on the testing, which is phenomenal. And it would be one thing if it just came out with the results saying your sleep score or whatever it is a D. Have a nice day. But no, they actually give fairly simple and practical solutions. Yet those are solutions most people wouldn't think of. People know to put down your electronic devices well in advance of going to sleep. People know that one, but the whole thing with the curtains, the white noise, the chamomile, possibly some people may know. I mean, these are really, as you said, simple but helpful things, right?
Yeah, and that's what I'm talking about. And again, the sleep report in and of itself is 44 pages, okay? I've picked out a couple things to talk right now on the show about just to highlight the helpful tips that are in here. So this is, and again, the thing here is this is based on your unique genetic profile. These aren't the average recommendations for everybody. Now, some of those things are generic recommendations that would likely help anybody, right? I mean, having blackout curtains for sleep is probably a good thing no matter what. But, we could go on into so let's go into the next one, which is the cardiovascular profile, because this will be a lot more personalized. So, again, as I look at mine, very easy to digest. I scroll through. I scroll the first couple pages. Again, tell me my risk in terms of, the actual genetics. But then this one, it breaks it down as your results. So it tells me, so the action, so your ability so my body's ability to remove free radicals, heavy metals, metabolites, pollution, chemicals. So all this stuff, my results, average, okay? As a counter that, your body's efficiency in using cholesterol to deal with inflammation, optimal. So it gives me a bunch of these different things where it's telling me I'm average, optimal, suboptimal. It goes into, this is one that everybody wants to know about for sure. 3 things: cardiovascular inflammation, which can contribute to heart attack and stroke, cholesterol, and high blood pressure. So it breaks it down into those 3 categories. For cardiovascular inflammation, for me, I'm medium to high risk. For the cholesterol, I'm normal risk, so I'm not at an increased risk. And for hypertension, high blood pressure, I'm at an increased risk. So right off the bat, I know where my risk factors are, okay? And that's an amazing thing. Then it gives me an overall picture, and it essentially says you're more likely to have an increased risk of cardiovascular inflammation, which, again, can lead to things like stroke and heart attack, which I knew about myself because I've already seen these things in my family history. But it doesn't stop there. What's great about this is it gives you action items. So what are some of the things that you can do? So it has a whole section, our recommendations for you. So, and it goes very broad in some sections and gets very narrow in others. So lifestyle and environment. So optimize your nutrition habits, prioritize physical activity and sleep, track biomarkers for cardiovascular health, and consider supplements, right? Now, that's very high level, but it goes further. So now it says from a nutrition standpoint, it says prioritize vitamin B rich foods. And it doesn't stop there. It gives you examples because, again, the average person sitting there is saying, well, what is rich in vitamin B? Well, guess what? They tell you sustainable fish, organic eggs, organic spinach, beer yeast, and nutritional yeast. Prioritize foods rich reduce significantly or completely avoid fried and sugary foods for your diet. So it's giving me the diet recommendations specific for my genetics based on my cardiovascular risk. Again, to me, this seems amazing for the average person to sit there and look at this report. It's going to provide such an incredible level of value.
Yeah, it's so cool. I mean, it really puts the emphasis on PinPoint Health to be clear about that. And it's not just some book that anybody can go and take out of the library and they're all reading the same stuff. This is so tailored, bespoke for you that I guess everybody would have the same result. And but I mean, this is something that they would still want to after this test is to sit down with you and get down to the nitty gritty with it, right?
Well, absolutely. I mean, the thing about this test is, again, this is very much a wellness-based test. This isn't diagnostic. This is about if you want to find out on a deeper level about yourself. What I essentially say to people is, I can order the test. You don't have to follow up with me. You can look at it on your own because it's not diagnostic. It's a wellness report. But most people, 99, actually, I don't think there's even been one person that's opted not to speak to me following the report, want me to sort of go through it. It's still a lot of information. Like, again, going back to this cardiovascular thing, it doesn't even just stop with what are the diet recommendations. It says we recommend you get these blood tests so that I know based on my risk factor so I could speak to my doctor. So cholesterol profile, homocysteine levels, hemoglobin A1C, vitamin D, CRP levels, and ESR levels, different things looking at inflammation. Very specific, right? It's giving you a toolkit also to look at what are the biomarkers that may indicate that the risk from a genetic profile might be actually real in real time, because that's the thing about genetics. It doesn't mean you get it. It's not necessarily that you get something that's in your genetics, but if something triggers it, it's going to be there. And this gives you the sort of the biomarkers that you may want to look for, or your healthcare professional at the very least can look for.
Let's take a short break and get back to lots more of this. You want to reach out if this has piqued your interest with Dr. Lou. You can take advantage of it. Really, just make that phone call and 1-855-55 Dr. Lou, DRLOU. Simple. Type that into your phone and talk to him. Talk to a member of his team. And go to pinpointhealth.ca as well. We continue Pinpoint Health Show on Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
All right, welcome back. Pinpoint Health Show. Dr. Lou, of course, ready to go anytime and hook you up with a clinic near you and get one of his clinicians to see you, have a chat, and get on that road back to what you could potentially be health-wise. It's always good to at least have a conversation. 1-855-55 Dr. Lou, DRLOU. It's really simple. Clinics opening all the time. They're open. They're ready to serve you. PinpointHealth.ca. And if you want to send an email along, ask some questions, info@PinpointHealth.ca. as well. Dr. Lou, let's pick it up where you were talking about last time, the expansion of this genome testing. That's been amazing for you, and it's really giving you a roadmap of health. Again, it's not diagnostic. It's health-based, but it's really interesting stuff and worth a look for anybody listening for sure, right?
Absolutely, and the listeners have heard me speak about this now for a number of months. The big thing that I'm introducing today is the revamped report that the company is now offering that is so incredibly digestible for the average person. And we ended that last segment. We're going through my report today, essentially, and just using my examples in order to highlight how user-friendly this report is now. And we finished off there with the cardiovascular report and just some other sections in there. Again, I was still looking through it and saying, wow, so here's another section within my cardiovascular report, again, based on my specific genomics. The recommendation here is stop doing these behaviors. And it gives me a list of things that I should stop doing. So stop eating foods that contain preservatives and food coloring. In addition, don't eat processed foods or fast food. Stop eating fried foods. Stop smoking, things like e-cigarettes or hookah or shisha. Minimize consumption of simple carbohydrates such as sugar, breads, and pastas. Avoid or reduce alcohol consumption. Again, incredibly simple things that are the things that I would otherwise tell someone if I saw this type of genetic profile. Another aspect that people are always wondering is what is it that they should or should not be taking? Well, again, supplements to improve your cardiovascular health. Again, my report specific to me. So the things that they're recommending for me: omega-3 fish oils, a detox optimizer, a methylation optimizer, a mitochondrial optimizer, and vitamin D. So again, just incredibly simple but effective value from this report that, again, when I speak to someone, I'm going to speak with them for an hour following that. A lot of the times, I mean, anyone that's listened to the show, and John, you'll laugh when I say this, people know I could talk a lot. And it's hard to remember everything that I'm going to say, right? The nice thing is I'm going to say this stuff, and then you have something that's easy enough for you to refer back to, practical tips, practical advice that you can look at and start implementing into your life. And again, you don't have to implement everything on day one. In fact, it probably won't work if you do it that way. But if you implement something, again, to steal Greg Wells, sort of, who we've had on the show before, when he says try to be 1% better every single day. And if you could do, one thing new every week out of this report, I promise you that when you look back in a year from now, your health is going to improve tremendously just by implementing these things that are specific to you, to your genomic profile. And that's the thing that I really love about this genomic testing is this isn't generic advice. This isn't like, now, granted, John, we know it doesn't really matter what your genetic profile is. Everybody should be exercising, as an example. But what type of exercise should you be doing becomes the question. We all know that you should be eating healthy, right? Not a surprise. But what is healthy eating for different individuals? And that can very much vary, right? Some people can have the carbohydrates and other people can't, like I just read my report. So incredible stuff. Another new section here that they've broken in is immunity. And this looks at inflammation and the immune system. And in all honesty, with what's going on in the world right now, I don't think there's probably a better time than understanding your immunity. One of the things that it looks at here is my overall grade. So again, it gives you this overall grade, which I absolutely love because, again, everybody understands that simple grading of A, B, C, D, and you can appreciate where you fall on the spectrum. My overall grade for immunity, a C. Again, you don't have to be a rocket scientist or a top-notch world-class doctor to understand that that's probably not great. And so now it starts to give you, okay, well, what contributes to you being at a D? And as an example, a C. As an example, my vitamin D levels, I get a D in that. So definitely vitamin D is something that I need to be working on. And then I got Bs in a couple other areas and a C somewhere. So it really is like school. It averages out. But again, it gives you all of these things on where your risk factors are based on this. But it gives you practical tips. So again, so I know that vitamin D levels I'm poor in, so and from a genetic perspective. So right off the bat, our top tips for me: get direct exposure to natural sunlight. Boom. Yep. Something very simple that I can implement every day of my life, a little bit harder in the winters. But number 2, take a vitamin D supplement. This is where I've been telling people, when you can get more vitamin D in the summer months, you might tone down the amount of supplement you take in the summer. And then the minute winter's back, you can up that dosage because obviously sunlight is not going to be as prevalent. So you can do different things at different times of the year to get what it is you need. Again, it gives you these great things. Consider doing these one-time actions. And again, this is specific for me. Create an outdoor area that you can read, sip tea, or talk to phone on friends. Again, because it's trying to promote me getting vitamin D. So it's giving this very nice, helpful tip. Start an outdoor garden. That would force me to be outside more. Move a chair or couch in your home very close to the window so it gets direct sunlight and you're sitting there. Find a friend who wants to take a walk outside with you on a regular basis.
Yep.
Join tennis, swim clubs, whatever. Again, like it almost seems too simplistic, but yet so effective, right? And that's what I love about it. And that's where I think you really create value for the average person and for the average patient. who's looking to optimize their health, who's looking for overall wellness, is a lot of these simple, helpful tips. Because you don't want complicated advice either, John. Like, that's something that I'm big on with what I've done since I've been a practitioner. I want to give people the simplest, most practical advice for two reasons. Number one, it likely works because simplicity just seems to work that way. And number two, people are going to stick with it that way, right? Like, if I can get vitamin D naturally, that's going to be way easier than telling me I've got to go take all of these supplements. So real simple, effective advice creates a ton of value, in my opinion.
Yep, get out and ride your bike. Simple, vitamin D installed. But did you? I mean, if we're talking about school here, I know I never did. But as far as this test is concerned, did you anything come back an A for you? And if so, what would be the recommendation?
Yeah, no, I think the last A I got was when I was in school, John. No, and here's the reality too. This brings up an interesting point that has very little to do with genomics, but overall with health in general. I think people need to realize that the idea of optimal and like we always talk about, well, here's normal or here's more, even with musculoskeletal health, like where people will say I have poor posture. It's like everybody does, right? Like none of us are a robot, right? Like none of us are created perfectly. And so there's always going to be these anomalies. I've seen a lot of Bs in my report, which is probably good enough. You know what I mean? Like at the end of the day, we are still humans, and we're still going to have faults and not likely to be perfect. I don't think that the reality of waiting for A's in your genomic profile, as this test would give you, is a reality, because I think there's so much variation in the human genomics and it's so complicated that there's always a way that we could be better. And if someone had straight A's, that's probably the person that will live to 120, right?
Yeah.
So no, I unfortunately don't have any A's in here, but I don't think that matters for me. I think what I know sort of that health is not a perfect thing for anybody. For me, where the value becomes is what is it that I can do to be better. And again, I'm a big proponent of the Greg Wells model of be 1% better every day, and then sort of it in every aspect in your life, right? If you can do 1% better a day, in a year, you're 365%, right? That's tremendous leaps and bounds that you can achieve. And if you think that way, I just think there's, that's when the magic happens, right? Like some people, and this, John, because you've done it, sometimes it just clicks, right? Where you get on and it just snowballs. Like once you're doing one thing right, other things go right, and it's just a beautiful thing for overall wellness.
Again, reaching out to Dr. Lou anytime you want to take advantage of this or have a greater chat, you can, 1-855-55-Dr. Does this change? I mean, you and I are not that far apart in age, but if someone who's 25 doing this and someone who's 50, well, you're getting there, pal. Sorry to tell you. But someone who's 25 and someone who's 50 like me, I mean, are the results going to be obviously tweaked and the to-do list at the end of this is going to be different, I guess, for different age groups and sexes for that matter, right?
Yeah, again, the beautiful thing about this is it's based on you personally, so whatever you are. And so, yeah, I mean, the one thing about genetics are genetics, right? Whether I take this test today or when I'm 55, I'm still going to have a high risk of inflammation for cardiovascular health. That's just the reality. Again, remember, this isn't telling you that in real time you've got cardiovascular inflammation going on, because maybe you've done all the right things. In fact, a lot of the things that my report recommends, I already do. So I'm reducing my risk. What this is telling you is simply from a genetic perspective, here are where your risk factors are. It doesn't know whether that's why you've got to go get the other stuff. Like that's why, as an example, it recommended go get this blood work, because that blood work will help me to see, okay, well, is the risk factor that I have from a genetic perspective real right now? Has it reared its ugly head, or am I doing a good enough job of keeping it at bay? And that should really be the goal, is that you never actually realize the risk, right? Like you don't get to that point because you do the right things. And that's the advantage of this type of report and actually having it earlier. I mean, late is better than never, but I would say that this is definitely something that I'd want to know earlier rather than later, because it gives you more time to intervene and implement some of the things that are recommended that are a benefit to you.
Before, I know we got a break in about 2 minutes, but just as far as going forward with this whole thing, I mean, I'm sure you've convinced a lot of people now that we've been talking about it for months and months, because it is a really good thing. It's a wonderful tool. How easy is it to get started, and what's the cost for it?
Yeah, so very simple. Just give us a call. In fact, I can't remember the exact price, but I actually know that in this new report, the price has actually come down. There's more value, but the price has come down. So I think it's in the $400 something range versus getting up there towards $600 with taxes and everything. And before there was shipping charges, now all that stuff is clumped in together. So it's actually gotten slightly more affordable. And again, a very good thing. This is another huge area. Anytime someone wants this done, they want to know what they should be eating. And here's my diet breakdown. So this does a great job. It breaks down the 3 big macronutrients: fats, carbs, and proteins. It tells me my profile on my ability to use those things. And in all 3, I actually have an average profile. Now, it doesn't stop there. What it says is, so it'll say fats. It says I've got an average profile. And it says you're a good candidate for a balanced fat diet. So reduce consumption of saturated fats such as butter and cheese. No more than 20% of your daily intake should be fats. And you have an optimal fat sources: olive oil, avocado, nuts, and seeds. Same thing with the carbs. Good candidate for carbs. No more than 25%, no less than 75% of carbs from your fiber source. So it gives you, again, these very practical advice. It gives me, like, I look at this, and this is what I would say to a patient if I saw average profile in fats, carbs, and proteins. I'd essentially say to that patient, hey, you can eat a little bit of everything, but just keep it in moderation and make sure it's healthy. Versus some people might be more skewed towards like, hey, you should very much be focusing more on the fats and no carbs almost at all. Mine's telling me, hey, you can eat a little bit of everything, just moderate it, make sure they're healthy choices within that. And then it even goes into the micronutrients. So it tells me with vitamin A, I've got a suboptimal profile. Vitamin C, I have an optimal profile. There's my A finally, John. I've got an optimal profile, so I don't really have to be, supplementing with vitamin C or anything. Vitamin D, suboptimal, and zinc, optimal. So I'm good on 2, and there's 2 things that I likely should be supplementing with. And then this is interesting. It even gives you your potential health concerns. So my risk of obesity is normal, binge eating, normal, food addiction, normal, so on and so forth. Weight gain due to fat consumption, weight gain due to carb consumption, normal. Again, when I look at this type of report, I would end up telling this type of patient, again, what I've just said: you're good. Have a little bit of everything, make them healthy choices, make them moderate calories, and you're going to do just fine. You don't have to be on one of these extreme diets one way or the other. And that's a powerful thing for people because, I mean, some people love a certain type of food, but they've been sold on this idea that if they go on this, whatever type of diet, is going to be the right thing for them. But maybe it's not the right thing for them, and it's not the right thing from a genetic perspective, and it's maybe also not the right thing from a psychological perspective. I could tell you, John, seeing this report for me gives me a psychological advantage to wanting to eat healthy because it essentially says, okay, have a little bit of everything. That's an amazing thing for me to know about myself, which, I otherwise wouldn't have known. I would have thought that maybe I should go more on the fats and proteins versus the carbs. But this report's actually telling me, no, you don't have to completely shy away from all of them. Just reduce it to no more than 25%. That's great. I can, enjoy more of the things that I actually love to eat this way.
We'll take a short break and get back to more. PinPoint Health Show continues on Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Welcome back, Pinpoint Health Show. Dr. Lou here again this week, of course. 1-855-55 Dr. Lou, DRLOU. That is the number we keep throwing out there. You make that phone call and have a chat with Dr. Lou and a member of his amazing team at a variety of clinics around the Southern Ontario area, and always growing. Info at pinpointhealth.ca. And let's get right back to it, pal. You're very excited this week. The genome testing. We've talked about this before, but this thing is just awesome. Just awesome.
You're right, John. I'm excited more so not just because of the genomic testing in and of itself, but the level of benefit to this report. Here's another section. We just ended by talking about the diet profile, and I took us through like my that I could be having a well-balanced meal. Here's another thing that's in this. Amazing. Your suggested eating schedule. Like, here is a schedule on when I should be eating based on my genetics, okay? So it says between the hours of 6 a.m. to 10 a.m., I should be skipping that. That's sort of the idea of intermittent fasting. So this tells me, based on my genetic profile, intermittent fasting might be an actual benefit for me.
Wow.
Between 11 and 1 p.m., I should have a meal made up of protein, such as eggs, beans, or a serving of meat, a little bit of fat, and a little bit of carbs. And that could be something like an avocado, and the carbs could be something like oatmeal. Then between 2 to 4 p.m., I should have a nutriently dense snack if you're still hungry. So something like nuts, maybe a bowl of yogurt. And then between 5 and 7 p.m., a meal that's high in proteins, something like salmon, chicken breast steak, and a side of nutritionally dense vegetables, broccoli, sweet potato, cauliflower, mixed greens, along with a little bit of fats, some olive oil maybe. And between 7 to 9 p.m., skip. Again, what is this telling me? Very much that intermittent fasting type of thing. You're eating in an 8-hour chunk and sort of skipping 16 hours. And that's amazing for me to know from a genetic profile that if I tried that, it would actually work. And I don't have to play a guessing game. And that's one of the things that I've always loved about this genomic profile is it takes away the guessing game in what it is you should and should not be doing. I think that provides a lot of power to someone when you're on that journey, because it's very frustrating, right? Like, you might be eating a certain type of diet, and a lot of people will stop just because they haven't given it enough time. It takes time for your body to catch up and start getting with it. And sometimes people get frustrated because they say, well, I've been doing this for a month and I don't see any difference, so boom, I'm going to throw it away and see you later. But that might not be the right thing. If you know from a genetic perspective that, no, hey, don't throw it away yet. Stick with it, because it might take 3 months, it might take 6 months, but at some point it's going to start working because it's right for you on a genetic perspective.
1-855-55 Dr. Lou is the way to get a hold of and get this thing started. And I mean, you really encourage people to do this, because the important thing, I think, at the end of the day is the steps taken to, correct these things or follow the suggestions that come off the bottom of this test. Or really, they're doable. A lot of people just don't want to, and you can't blame them. I mean, it's, everything seems to be a bit of work these days, but, the advantage is just taking the simple steps guided by you, and the results of this test can really make some huge changes for people.
Absolutely. Another great section here that provides a ton of value, what they call the executive function for mood, behavior, and personality. This one in the last report was actually, it was almost too medical, because it was very much based on different things that were all very much the genes and a lot of research behind it. And this now provides an amazing level of results. So first section for me, work and career. And it actually breaks down. So I am more likely to, that's the way, this one, instead of giving you an A, B, C, or D, it'll say more likely, less likely, or normal. So I am more likely to excel in reward-oriented careers such as sales, business development, and entrepreneurship. I'm less likely to be personally invested or influenced by emotion in careers that involve high levels of trauma, stress, or tied to emotional situation. Examples of these, an ER doctor, right? And that's so true with what I do, right? Like, I could see that the genetics profile is real. Like, I'm very much involved in this world of wellness. I love health. I would not be good in a scenario where I would have to see traumas every day. Like, that's a special type of person. That's an emergency room doctor. And I think, my thanks goes out to them for what they do, but it's not me, right? Because that just, and I knew that about myself all along. But this is great. Could you imagine doing this for your kids when they're young and helping them to find the right career path, not based on some guidance counselor who, probably doesn't know very much about them, but rather based on their genetic profile and what their mood, behavior, and personality might be like? Another section. So more likely to be easily distracted when completing tasks. 100% true, John. 100% true. Family and relationships. So it even gives you, likelihood less likely, needs to build stronger emotional connections and relationships with family and friends. Intuitively pick up on body language and facial cues. Again, a lot of stuff. Like, I don't have to bore people with my specific results, but just great. This one is really interesting from a diet perspective based on mood. So I'm less likely to engage in emotional or binge eating as opposed to grazing or snacking behaviors, but I am more likely to use food as a coping mechanism for managing stress or negativity. Again, it gives you tools that you can work towards, and this is great. So such a comprehensive report start to finish, right? This isn't just, here's what you should be eating. It gives you stuff on sleep, immunity, cardiovascular health, diet, and mood and behavior. I just think for anybody really looking to take themselves from a wellness perspective to the next level, incredible value.
It's really cool. Take advantage of it. 1-855-55 Lou, DRLOU, info@pinpointhealth.ca. Do the investigation. It's really it's an amazing investment to be told. I'm not trying to sell it. I'm just telling you what we've been truthfully talking about for the last several months. But I'll give you that number as we take a short break. A little more to go right here. This is the Pinpoint Health Show on Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
All right, welcome back. Pinpoint Health Show. Dr. Lou here again this week, giving out the information, helping you out. 1-855-55 Lou, DRLOU, and info@pinpointhealth.ca. That is the email address. Of course, pinpointhealth.ca, the website. Go there. You want to find a clinic that is serving folks just like you, near you, in your location, and always expanding, always looking to open more. You can do that on the website. And the Lou Down is a long-form podcast. Wherever you get your favorite podcast, check it out. The Lou Down is what you want to follow. Go ahead, pal. Take us home for the last few minutes.
Yeah, so John, this show has been very much focused towards the genomic testing that we've been doing today. I really wanted to introduce a revamped version of the report that is much more user-friendly. The last report was very good. I don't mean to make it sound like, the last one was garbage. It was a really great report, had a lot of incredible information in it. But, like anything in life, evolution is important and getting better is important. And the company saw that as something that they should be doing as well, and really evolved this report more for the average person versus the clinician. And the last report was very clinician focused. And so, it was easy enough for me to look at it and pull the stuff that I needed to pull out of it, but not quite as easy for the average person to do that. And so, one of the things in this report is just the simplicity of it and the effective use of giving you sort of your risk or where your risk may be, and some helpful tips around what you should be doing, maybe, and that could be a combination of whether you should be getting specific testing done or you should be eating certain things, supplementing with certain things, doing certain types of behaviors, avoiding certain types of behaviors. Again, just a tremendous amount of value for the average person to have this type of thing when you're looking for optimizing overall wellness. And again, this isn't general advice for optimizing your wellness. It's advice based on your genetic profile, all based on evidence. And I think that's a really, really important point to underscore there. This is specific to you, and it's supported by evidence. This isn't just someone in their basement writing it out and saying, "Well, I think you should do this." All great stuff. Again, not a diagnostic tool. It's not there to figure out what's going on with you. If you do have something going on right now, definitely something I can help with. And I've talked about that a lot over the history of this show. But definitely right now, this is, again, more for the average, for the person looking to optimize their wellness, not a diagnostic, report, but a wellness-based report. It can give you insight into yourself that you can use to overall make yourself better.
And the cool part of it, and we've talked about this even with this expanded report, the improved report, but just the test overall, because this is genome testing, this isn't something that's going to be good for 6 months or a year. This is you. This part doesn't change. This is a lifetime piece of knowledge, which I think is really cool, right?
Yeah, that's an incredibly important point, John, that you're absolutely right about. This isn't something that it's going to be obsolete in a couple of months. No, in fact, it's always going to be totally relevant for figuring things out about yourself. And again, remember, seeing the risk doesn't mean that you have the problem. As an example, I said in my report there, I'm at an increased risk of hypertension. I'm not hypertensive, though, because I've been trying to do the right things. But I know that I have an increased risk, and it makes me more aware to avoid the things that I know will contribute to hypertension. I don't have that type of genetic profile where I can maybe go, a little weak on that end and focus on other things. So what is the practicality of the advice there, excuse me, is cardiovascular exercise is important for me. I'm not someone that should just be weight training. I should be doing cardiovascular exercise, walking, elliptical, running, swimming, anything that gets my heart rate up. That overall will bring my heart rate down over time and help me to control my hypertension, managing my salt intake, managing my stress. So these are all things that I know that I need to do because I'm at an increased risk for hypertension.
It's really cool. Any other final thoughts in the last couple minutes about it or anything else, pal, before we wrap?
Listen, John, like I say for everything, you might just be wondering about it. Excuse me. Just give me a call. We can talk about it. I'll call you back. We'll talk about what it is exactly that might interest you. There's been people that have called me for the test, and they're actually looking for something more diagnostic. And I say, don't bother with this. It's not going to give you what you're looking for. You can do it if you want from a wellness perspective. But if you're just interested in more information and the specifics of it, I'm happy to have those calls. And I encourage everybody to call it. That doesn't cost anything. It's available. Why not utilize it? We can have a quick conversation on what it is that you're thinking about yourself, and we could see if this is value for you, for your family, whatever it may be. I've had people that have called and order it for their whole family because they want to know. They want to implement a wellness plan in their whole family, and that is essentially what we try to do. And we can give help create a roadmap for that. But again, it just starts with a simple phone call. There's nothing more than that. It might not be the right thing for you based on what it is exactly you're trying to achieve. It's also not, again, an ancestry test. This isn't, I've had people call and say, well, will this help me figure out if I'm, part this, part that? No, it has nothing to do with that. This is genomics on those areas that I spoke about before. And it can help you towards your overall wellness plan that you're looking to achieve.
Do it. Take advantage. At least make the phone call and have a more in-depth chat with Dr. Lou or a member of the team. It's so worth it. I'm telling you, 1-855-55 Lou, DRLOU, the number anytime. And you want to go through the email route, info@pinpointhealth.ca. And, of course, the website, always a place to stop by, pinpointhealth.ca as well. We'll pick it up again next time. Pinpoint Health Show, Global News Radio.
The preceding was a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.